Jessie B, and I've been a dental hygienist for 3 years. Clinically, I've always been in a clinical setting, and I wanted to share with you guys some tips and some gems that I've learned over the course of those 3 years, just regarding what I've experienced, what I've learned. Some are clinical, some are emotional, and some might just surprise you. So whether you're a new grad, a hygiene student, or whether you're just being nosy, hey, all are welcome. So sit back. I'm gonna just go over a few things that I've learned being in the field, and maybe some things that you can take with you as lessons learned, so that you don't have to go through those same things. So sit back, get you a snack, and here we go. So in school, you learn the basics. You learn the hands-on experience. You learn how to handle an instrument, how to, literally do a comp exam from start to finish, what to do, what not to do, what to expect. But in the real field is where you learn the most. It's the stuff that you learn in school kind of has to be relearned in a way. You kind of have to adjust those things, because clinical life is so different than school. You're learning how to talk to patients. You're not having your hand held by the clinical coordinator, the clinical instructor. Like, you're literally out there as the provider, teaching and learning and growing. And so you're growing emotionally, not just clinically. You're growing emotionally because you're learning how to adapt with different emotions, different characteristics throughout your job. You run into nice people, happy people, sad people, nervous people, people that have never been to the dentist before a day in their life. You're learning everything and how to adapt. And so that leads me to my first tip. You got to learn how to adapt. I believe that school is great, of course. That's where you learn everything, but you don't learn how to adapt when you're going from clinical, like in school, to actual real life. They don't really give you that hey, look, this is gonna happen, like, type of scenario. Like, you literally learn, and once you hit the field, you kind of get like a little bit like taken back. It's like, wow, this is nothing like I thought it would be. And it can be a very discouraging. So I'm here to tell you guys that's completely normal. It's okay. When you are first hired, the job, they should already know, like, hey, I'm a new grad. Like, there's still stuff that I have to learn as well, different systems, different techniques, even just getting your patients sitting down. Like, that takes time. Like, learning how to, talk to your patients and get to know them, that takes time. Learning that you're not doing every single step and having to get checked by an instructor, that takes time. Like, you're just like, wow, I really don't have to get a check every single step I take. Like, that is going to take time. So learn how to adjust. Don't feel like you have to adjust quickly. Like, they're gonna be there for you. At least they should be. Your job, they should understand, like, hey, it's gonna take time. Ask for more time for your profis, for your exams, what have you. Make sure that you are comfortable, and so that you can slowly adjust to that workforce. So lesson learned, within 3 years, I've had to start going to a chiropractor, and not necessarily because I have an issue. I'm not feeling like I'm burnt out or anything, but this is simply like preventative care. Just as you would have a regular healthy prophy, this is a preventative thing to help make sure that I'm still aligned correctly and I'm not overusing a muscle. So getting aligned and also getting a massage does help a lot. I know it doesn't seem like it. I know it seems kind of like, oh, you're just doing it just because you want to go spend some money. Like, no, a massage is necessary. Now, if you want a luxury massage, like, hey, albeit, but it is important to make sure you are aligned, make sure those muscles are relaxed, so that you're not overusing one muscle or the other. Everything is even. So please take care of your body. Whether you're a new grad, whether you've been in the game for 15, 20 years, it's always super important to have that your spinal system, your core, whatever have you, aligned, so that you are having the right ergonomics. One thing that I'll always mention is being a great team player. As they always say, there's no I in team. We get that. But truly, as a hygienist, people and agencies are starting to come for our jobs. Like, true thing. Like, I think Arizona was the first state to pass a law that allows assistants to do supragingival scalings. So yeah, shout out to dental assistants. I get it, but every job is hard. No matter if you're the doctor, the dental hygienist, the assistant, it's hard it's hard to be an assistant, it's hard to be a doctor, it's hard to be a dental hygienist. So don't feel like, please don't disrespect anyone's position, whether you're an assistant, a hygienist, a doctor. Please respect those who chose to be in this career field. Like, every job is hard. If it was easy, everybody would do it. So with that being said, please advocate for yourself, guys, especially hygienists. They are starting to really ramp up laws as to take our jobs. So with that being said, I want you guys to know that you have to be the person that cannot be replaced. Meaning, just because you're a hygienist does not mean you can't do dental assistant work and actually help out. I'm not saying you gotta help extract a tooth or do a filling. What I am saying is be helpful. You know where these instruments go. You know where these burrs are. You know how to take instruments out of the autoclave and put them up. Be a help. Be a team player. That way, when people question whether or not we're valid or if we should, be a hygienist and make this great money that we are and that we deserve, they won't have to question it, because not only are you doing your job efficiently, effectively, and making sure your patients are well educated and comfortable, you are also going above and beyond and doing other jobs to help the team, not to take away another person's job, but to add to the team, because assistants do so much, guys, and are underpaid. But that doesn't mean that we should be paid the amount that we are paid. But that also does not mean that you should be a stuck-up hygienist with a bad attitude and doesn't want to help out besides doing your cleanings and going home. You know what I mean? So I'm saying that to say, be a team player, help out. And if you don't know something, truly ask. Like, you should be able to go to your teammates and ask, like, hey, I'm trying to help you guys out. Can you show me where to put this burr, put this handpiece, so that I can, help out? So that when they're going through those motions of having to stay overtime with a patient, everything's clean. They don't feel like they have a whole laundry list of things to do. That is important. And the reason why I say that, you gotta understand, you're the hygienist, yes, you're great. Okay, the assistant stays with the dentist. And if the assistant doesn't like you, probably the dentist is gonna start, feeling some type of way as well. So why not make sure their right-hand man is feeling good about you? And not saying that, you're gonna get fired because someone doesn't like you. But you see what I'm saying? Like, make sure that you guys are a cohesive unit and that you are not slowing someone down. Like, if they see you sitting down and you could have helped bag these instruments, then I would feel some type of way too, because I'm like, you could have got your butt up and helped me. So with that being said, be a team player. It's always helped me throughout the course of these 3 years. I have always had good relationships with the assistants, whether I'm temping, whether I am at my current position. I've always had great relationships with the assistants because I know how to be a team player. So I'll say to like some of my videos where I was talking about being an introvert, I will say that you definitely learn how to talk to people. And if you're already good at that, fantastic. But it took me a minute to actually get into the rhythm of how to get people to talk, how to get people comfortable. All of that comes with time, at least for me, for my personal journey as a hygienist. Because when you first get out there, it's like nerve-wracking. Like you are worried about what to say, how to say it. You want to make sure you do everything right, and sometimes we overthink things and then we mess up. You know what I mean? So have those prompts, practice with your family, practice with someone to figure out ways that you can talk to patients. So normally when I bring my patients back, I'm pretty observant. I like to see what they're wearing. If they smell good, not trying to sniff them, but I can smell. I have great smell. If they smell good, if they have a purse, if they have their backpack with their laptop, those are like key things that I pick up on. You can also tell, like, hey, if they have their backpack with their laptop, they probably work from home. And if I see their laptop and their backpack, I'll ask, hey, do you work from home? Oh yeah, how long have you worked from home? Did you work from home before COVID? Are you in IT? Because a lot of people are in IT, like so many people, especially they work from home. So that kind of gets the conversation started. If they're wearing a wedding ring, I ask about their partner, how long they've been married, If you look at their file, the chart, as you should, before you grab your patient, you can see when their birthday was. If it was recent, I say, oh my gosh, when was your birthday? What did we do? Where did we go? And again, that gets the ball rolling. It gets people comfortable, especially if this is like their first time being there. And if you can tell that they're already kind of like reserved, that's a great way to kind of like open people up. And if they don't open up, it's okay. It's okay. As long as they open their mouth so you can get them clean. Like, it doesn't matter. So you're not always gonna have that personal relationship with patients. Sometimes you have to just, you know, check the vibe. Like, if they're not, you know, if they're like, okay, like, please don't talk to me, then you have to respect that. You're not always gonna have that bubbly, you know, patient. Sometimes you're gonna have a patient with an attitude, and no matter how nice you are, no matter how complimentary or, you know, willing to like bend over backwards for them, they're just gonna be, and that's okay, because some people have lived a hard life. I have so many people that, you know, might have been on drugs, might have been unhoused, things like that. It's kind of like one of those things where you kind of have to slowly chip away, and over time they'll get comfortable with you. But it's just one of those things. It is okay to not be besties with all of your patients. So yeah, don't feel bad. I will say a deep lesson that I've learned throughout the years is that not every mouth can be fixed in one session. No matter how great you are at cleaning, it does take time, especially for those who have just really prominent bacterial buildup. As you know, bacteria can multiply so fast, and so sometimes it does take a while for patients to see results. And I like to say, like, say for instance, you had a patient that hasn't had a cleaning in like 15 years. Sometimes I like to say, well, it took you 15 years to get this way. It's going to take some time to reverse this. And that kind of puts things in perspective for a lot of patients, because it's like, oh, okay, like, you're not magic, you know. As bad as I would want to be that person that can just fix you like that, I can't, because it does take time. So it breaks it down to a relative understanding, so people can kind of grasp, like, wow, she's correct, like, this does take time, and you're just gonna have to come see us a little bit more often to get the results that you're looking for, or at least try to get close to that that level. I would say another lesson that I've learned is that oral health is whole body health. So a lot of people think that the mouth is the mouth and it's not connected to anything else, and it has nothing to do with anything. It doesn't have anything to do with diabetes or preeclampsia or erectile dysfunction. Like, it has so many connections, and a lot of people don't know this. And a lot of people think that they're struggling with something else, when the mouth is something that can definitely turn on disease. So I will say that explaining to certain people, making sure you're doing your due diligence with charting, looking at their health history, is super important. I can tell when someone has high blood pressure just by looking in their mouth, because high blood pressure, that's one of the symptoms that you see, is sloughing on the gingival tissue or the oral mucosa in general. If you have them open, you're doing your exam, and you start to see like this mucus-like film on their gums or on their vestibule, you'll notice that it's like real sticky, and that's one of the symptoms of high blood pressure. And a lot of people, before I even like really go through their medical history, they'll be like, how did you know that? That comes from years of just cleaning people's teeth. Like, you notice things once you get in that rhythm. You notice that it's a lot of signs and symptoms of things that a lot of people don't know, because the mouth shows so much. You can really tell a story through someone's oral health. And so I just think it's really cool to like say that, because it's like, okay, people respect you the more you can tell them about their own body. And so of course you want to double back by saying, please go see your primary care physician, because this is an interdisciplinary thing. Like, we want to make sure that we are working cohesively with each other so that you are healthy no matter what. Yeah, just go do your research. Oral health is connected to so many things, especially with diabetes. I try to tell, my people, like, hey, this is something that is a bidirectional disease. You can have diabetes and you can develop periodontal disease, or you can have periodontal disease and develop diabetes because of the inflammation in the mouth. It can cause some damage. Okay, so it's super important that you know the mouth-body connection, because it really does play a big factor in people's overall health. I will say the most important thing that you can give someone isn't even a cleaning. It is kindness, it is encouragement, and it's knowledge, because knowledge has so much power. There's so many people that I've seen throughout the years that have been just so overly emotional, and it's not just because you're giving them a great cleaning. It's more so to do with just encouragement and making them feel seen and safe. So many people have had horrible experiences at the dental office. Like, I'm telling you, like, to the point where they didn't want to go to the dentist for several years, and you can see it in their mouth because their lack of oral hygiene. and good oral hygiene. And so it's just like, you're that person that can save them. People can die from stuff like this. Like I just said, periodontal disease has a bidirectional relationship with diabetes. And if they're not already keeping their mouth healthy, they're probably not keeping their body healthy. And so it's so important that you guys give them encouragement. You got to encourage them, because you might be the last person that they see before they just completely give up on taking care of themselves. And so don't be that person that does not have empathy or sympathy for someone. And you might not have empathy. You might not have been going through the same stuff that they've gone through, but to have sympathy and to be sympathetic and understanding and actually listening to your patient is what really matters. And if you don't have a heart, if you don't care, then you're in the wrong field. You should not be taking care of patients. You should not be seeing anyone, because you have to have a heart. You have to care at the end of the day. And that is an umbrella that is going to show throughout everything that you do. If you do not care, it's gonna show. So please be empathetic, please. And I'm getting really emotional because it matters. Like, this could be your mom, your dad, like anyone. And so you would want someone to take care of you, so why not take care of them? You know what I mean? No matter what they look like, no matter what their background is, you have to take that all away, because it's not about you at the end of the day. You have to put yourself aside and show and come through for people. Sometimes you're gonna be late because you need to talk to that patient. You might not be able to clean them the same day because it's pretty aggressive, like SRP or whatever, but take the time out to say, hey, I get it. There are so many people I've seen that have not been able to get a cleaning or have not had the chance to. Some people, again, have been unhoused on the streets, might not have had dental insurance. And it's up to you to be like, hey, we're gonna get through this. It's gonna take some time, but we're gonna get through this together. I promise you, whatever you need to feel comfortable, please let me know. And I'm super adamant on my patients communicating with me the same way as I communicate with them. Because if I'm the one communicating and you're not telling me, then we can't really build from that. It's super important that I express to my patients, this is a judgment-free zone. This is a safe space. If you just want to talk to me, that is fine, but please know I am here for you. You might not want to smile today, but I'm going to make you smile one day, okay? And so saying that just gives them encouragement to keep going. It's super important. I've seen so many patients, and not to toot my own horn, but I've seen so many patients just continuously come back and ask for me because I know how to make sure they're comfortable. That's all I really care about at the end of the day, is making sure everyone feels seen. And I think that's how the entire office is at my job. Everybody cares. They go the extra mile, and I'm so grateful that I work at an office that everyone is going the extra mile to make sure everyone's comfortable. And I think that's why we're growing so much. So make sure you guys are putting your heart first before your money. I think that's the best thing I could say. A little encouragement for my for my students, my hygiene students. Don't worry about them codes. You're gonna learn the codes eventually. Take it from me. I went to Fortis. We did not have a coding class. I think they took it away right before I came, and so it took me a minute to learn the codes once I got to when I was at Sage. I didn't really learn codes at Mint Dentistry. I was at Mint Dentistry for about 3 months, 3-4 months, but Sage really laid it on me, and that's when I started to learn my basic codes. So I would say the basic codes you really need to know are prophy, scaling with inflammation, your SRP 1 to 3, and your SRP 4+. And then anything above that, and the fluoride. So prophy 1110, scaling with inflammation, 4346, aka a gingivitis cleaning. I think the Brightman too, I don't remember that one. 4341 is the SRP 4, and then 4342 is the SRP 1 to 3. And then your fluoride is 1206. Also child prophy, which is very similar to adult prophy. I forgot that one, but most systems do have the codes in there. You can look them up, but if you don't know, just Google it. I mean, they're all the same. They should not be different, unless you're like at a different office where they have a system of their own. Sometimes it's just like one additional number, but literally you can ask. Like, you're not gonna get in trouble for the most part for getting a code, but just look it up. And so know your codes, but if you don't know them, don't stress. You will use them so much you start to remember them before you even know it. So don't worry about that. And one more thing before I let you guys go, I will say what's going on? I will say that you will get faster as you go. Don't feel like you have to rush. The thing that helps me the most is auditing before I get to, I would say auditing maybe 1 to 2 days beforehand, just so that your charting is up to date, making sure you don't need any x-rays, making sure that the patient isn't pregnant, needing pre-med, things like that, and also making trays beforehand. That helps a lot. Like, especially if you get behind, making a tray can take a day. You know what I mean? Like, making trays can take time because you might need specific things and you might be rushing, or sterile might be backed up. So going ahead and kind of like getting ahead of the game, especially if you don't have a hygiene assistant or a lot of people to help, just doing it, you know, the day before you leave. Prepping does help a lot, especially you might be late for work, you know, like who knows, there's so many factors that can go into, you know, running behind. So just prepping even a few trays, not the whole day, but just a few, can make a world of a difference when it comes to working in a clinical setting. I'd say that was the last thing. So advocating for yourself, it took me a minute to actually, you know, grow some, because I was nervous about standing up for myself. But truly, you are a provider. They might not see you as a provider, but you are a provider, and so you got to make sure you're advocating for yourself and standing up. Now, mind you, should you be, you know, a prissy princess and, you know, tell them no every time? Like, you got to be a team player. Like, everything's not going to go your way, but for the most part, if you're not wanting to double book and you've told them that in your interview and they're trying to make you double book, because you're trying to ruin my back, sis. So make sure you advocate for yourself. Write down everything. Create a paper trail, emails, like stuff like that, so that if someone tries to try you, you can try them right back, because that is not what I said. Stand 10 toes down on everything that you say. So advocate for yourself. Know your rights. Know the rules. Each state is different. It's regulated completely different at each state, so please know your rules, know your rights, protect yourself. I do have insurance, malpractice insurance. It's so cheap, guys. I think I paid $80 something for an entire year, and I think I have. Don't let me lie to you. It's either it's like 10% difference of either 100,000 or $1 million. I cannot remember. But either way, it'll be something's better than nothing. So make sure you get up on that. And also me learning how to do my CEs. I'm lazy. I'm not even gonna lie to you. Me doing CEs here and there is just not gonna cut it for me. Like, my mind, it just does not work that way. Hinman has already passed. I have been to the Hinman before, but it was not something that I enjoyed. And plus, I don't want to see nobody that I quit. I don't want to see no one from my old offices, because I quit for a reason, you know? And so what I do plan on doing is going to the RDH under one roof this year. I was thinking about doing Brown Girl RDH, but it's kind of cutting it close. I think it's towards the fall, and who knows what's going to happen in the fall. Like, I might have a vacation, you know, might want to go home to have, you know, family time. So I just kind of want to go ahead and get it over with, because I also will be getting my local anesthesia license, so I kind of want to get that done. So me doing an all-in-one CE event knocks out everything, so that I don't feel like I get overwhelmed towards the end of the year having to get live CEs or in-person CEs. Like, that it can be overwhelming when trying to renew. So it's best that you get them done all at one time. So I've learned that just going to an event like that does save time. So the event is July is it the 18th through the 20th, I want to say. I think it's Friday, Saturday, Sunday, and this is in Dallas. So I will be going to that. I've already got my hotel. I just gotta book the event, so that's gonna be really exciting, and I will be vlogging that. But stay up on your CEs. If you're not a person that can do your CEs here and there, then I would definitely suggest going to an event that they have everything where you need it to be. The reason why I don't care for him as well is because they don't really help hygienists as much as I wish they did. My coworker, she went and she didn't get enough hours, so she's gonna have to continue to go to other courses or do courses online. And so to me, it's just like why go if I'm not going to benefit from it fully? So definitely check out more specific conferences like the Hygiene Under One Roof or Brown Girl RDH. And you don't have to be brown to go. It's just called Brown Girl RDH, but we support all colors, all shades. You know, we love all hues. So please don't be discouraged if you want to go to Brown Girl RDH and you're not a brown girl. Okay, it's okay. But yes, guys, I know I've been rambling, but those are some of the things that I've learned throughout the years. And I just feel like I'm reiterating a lot that I already said, but it is true. Like, you have to stand on yourself. You have to be educated. You have to advocate. You have to have a heart, and you got to get your money. Okay. So if you guys have any questions, or if you guys have any video suggestions, please let me know. Shout out to my girl for requesting this video. She asked me this. She asked me to record this, what I've learned in 3 years as a hygienist, and so I was so happy to do it. So guys, if you have any video requests, please let me know, and I might not do it the same day, but I will definitely get to it eventually. So I love you guys. Y'all are so sweet. Y'all gonna give me a cavity. I love you. See you guys soon.